بسم الله والحمد لله والصلاة والسلام على رسول الله. أما بعد, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Sunday the Community with me, Hafiz Muhammad Umar. And in today's show, we are going to be talking about the excellent work of Phoenix Primary Care Network Luton. And to discuss this in more detail, I have Sister Farkhanda Mehmood with me. Assalamu alaikum, Sister Farkhanda,
Walaikum salam.
and welcome to our show.
Thank you very much for having me.
And thank you so much for taking your time to come and join us. Sister Farkhanda is a manager at PCN Phoenix in Luton. And if you are a local resident of Luton, registered with the local GP service, you may well have heard about the PCN's primary care network. And there are a number of them currently operating in and around Luton, and Phoenix is one of those. And Sister Farhanda, could you tell us a bit about Phoenix Primary Care Network, please?
Yeah, sure. So PCNs mean primary care networks, as you mentioned. So there's six PCNs in Luton. Phoenix is one of them. We cover 5 practices: Kingsway and Birmingham Medical Centre, Conway Medical Centre, Neville, Pastures, and Malzyard. In total, there's roughly about 50,000 patients that are registered under these practices. And so we help the practices look after those patients proactively.
And you mentioned it's one of many. I'm just looking at the others, or other residents of Luton might have heard of Medics or Hatters Health. Are they the sort of primary care networks that we might be talking about?
Yes, so the other primary care networks are Medics, Hatters, Oasis, Equality, and Lee Bale.
Okay, not Eden.
No,
Okay,
there used to be a PCN called Eden, but it doesn't
that not
exist.
right. Okay, is that what has now become equalities then?
Possibly I couldn't really answer you on that.
Okay, okay.
Yeah.
And it's just that I found this list of the PCNs in and around Luton, and as you're going through, like, yeah, I can take those off the list, and yeah, Eden and Equality, right? Okay. So our focus today is primarily on Phoenix and the work that you're doing, and you mentioned the number of surgeries that are associated with Phoenix. So is Phoenix like the overarching umbrella above these surgeries then?
Just to explain a little bit of background to you then about PCNs, I think I should start with that first of all. So PCNs were created, so to speak, in a very unofficial way. They weren't structured in terms of a legal entity. They were there to support a network of additional reimbursement roles that primary care never had access to. So it's difficult for me to say that I am an umbrella company over the practices because we're not really. What we do is we support them. We work very collaboratively with them.
Mhm.
All of the managers in our 5 practices will work with me and I will work with them. There's no kind of hierarchy in leadership in that kind of sense. But we work collaboratively because primary care was on its knees, basically. In GP practices, the GPs and the managers and the staff in the practices were firefighting every day, trying to manage the workload, and PCNs were formed so that we could alleviate some of that burden. Primary care was working very reactively. You had a problem, you called the GP surgery, and then the GP surgery, was dealing with it. We are now looking at ways to work with patients proactively before the problem gets so bad that they do need to, go to a GP, or they do need to attend a hospital appointment, or, see the A&E department. So that's how we work. And I will talk a little bit more about the projects that we've done in our PCN when we get to that.
Okay. Um, Brilliant. And just following on from that, really. So, how can the PCN support practices, and what kind of things do you do?
Right, so we support practices with services that we provide, but more than everything else, we support them with access. So It's common knowledge that about 70% of the appointments that are booked in with GPs are for minor illness, for example. And these kind of appointments can be seen by other healthcare professionals, like, for example, our physicians associates who see minor illness patients, like our paramedics, first contact practitioners, like our physios who also see patients. All of the stuff that a GP would normally do in an assessment, for example, if a patient had called for a problem or pain in their muscles or joints or bones, the receptionist would have normally booked that appointment with the GP. The GP would have done an assessment. If they had to be referred for an X-ray, they would have referred on. If they'd had to be given painkillers, they would have given painkillers, or if they would have had to have some further referral into physio or MSK, then they would have done that. What we've done is we've created a service, MSK physio service, where all of those patients who call in with those kind of problems, they can be diverted into our service so that it frees up the GP to see other problems, other acute problems. So we're freeing up space in terms of physios. We're freeing up space in terms of minor illness. We're supporting the GP practices in terms of social prescribing, when they need to be referred for housing or when they need to be referred for employment help or benefits, things like that. We're also helping with health and wellbeing coaching. Some of the projects that we do that are proactive will be around inequalities and addressing some of those inequalities in our communities.
Okay, brilliant. When people ring up in the morning, typically to book an appointment, and usually a common question gets asked, what is it that you need to see a GP for? Is that the initial kind of triage where the receptionist can determine whether to send the patient to the GP or to one of those professionals you mentioned there?
Yeah, absolutely. That's correct. Yeah, that's the way that the
Okay.
triage system is hoping to be working well on.
Mhm. Right, okay. And just to sort of like recap what Sister Farkhanda mentioned there, so the team would consist of physician associates, paramedics, health and wellbeing coaches, care coordinators, pharmacists possibly as well. Can the a receptionist say, actually, you know what, for that you can just see your local pharmacist? Would they actually go that far, or would they still want them to be seen by one of the other professionals beforehand?
Yep, so there is a system called, I think, Pharmacy First. This is
Okay.
where the receptionist will triage to your local pharmacist, but the pharmacists that we provide in the PCN are here to support with back office work, work that the GP would normally do, like medication reviews, supporting our care home patients with their structured medication reviews, any questions around MDTs for patients, discharge summaries from the hospitals, amending medications, switching them, things like that. But yes,
Yeah.
patients will be triaged by the receptionist to go to their local pharmacy for any minor ailments that they can see the pharmacy for and pick up any medication over the counter for.
Brilliant. And then the final role you mentioned there was those of the social prescribers. We'll come into these roles a bit more later on in the show. Going back to some of the additional things that you do as a PCN, so targeted clinics, for example, how do they work?
Right, so the way that I've set up the service here for the team is we do distribute some of our staff to the practices. So they will have seen some of our team members in their practices if they've had an appointment with a minor illness clinician. The physios are obviously going to be seen, and the physios are based in Kingsway Medical Centre. So they would, if they have had an appointment with the physios, they would have seen them there. They're all face-to-face appointments. All of the appointments that we provide in minor illness and physio are all face-to-face. But there's other work that we can do in terms of if the GP needs to refer for health and wellbeing coaching or social prescribing, there's a system that is in place where they will call the practice, the patient, and then they will be tasked to us via System 1. That's the clinical system that we use within our PCN and practices.
Yeah. Okay. And then there are some care homes that you work with as well.
Yes, so we work with 5 care homes in Luton, mainly looking after the elderly residents. This
Hmm.
is part of the work that we do to help with the burden on general practice. So if you want to think of it practically, what would normally happen is if a patient in a care home became ill, the carers would call the GP practice. The GP would have to then go to the care home to see the patient, review them, do whatever checks they would need to do, perhaps refer onwards. And that would take a significant amount of time out of the normal
Mm.
GP day. But now what we do with our service is look after those patients almost, let's say 95% of the time. So we do a weekly ward round, so to speak. Our paramedic team, clinical team will call the care home. They will check in to see with all of the patients how they are. If there's anything acute or that needs to have a home visit, we will send our staff to the care home to get any of the readings or do the checks or the referrals onwards. Just basically a home visit in the care home. And
Mm.
then we will do the necessary changes in medication if needed. We have a GP lead here at the PCN as well, who oversees all of that clinical aspect.
Okay, brilliant. And just to get some clarity on the five care homes you mentioned, I can see the following: Rosedale, Ambassador, St. Anne's, Edwardian, and Windermere House. They're the
Yes, that's
five.
right.
Yeah, they're the five still working with, right? Okay. And so, if any patients needed any targeted clinicians there, like diabetes, for example, or ECG, would that be offered at the care home, or would those patients be brought out to another clinic?
No, no, we could do that at the care. We do that at the care home.
The care home. So it's like literally having a doctor coming to your house, and except you've got the team of experts that are able to save the GP that time to be able to get straight on with what the patient's primary needs might be on that particular day.
Yes, that's right.
Um, okay, and some additional proactive projects that you're working on at the moment. You want to tell us a bit about them, please?
Yeah, so we aim to address lots of health inequalities in our communities. A couple of the projects that we've done, we did a prostate cancer project recently, where we targeted specific cohort patients. There was roughly about 400 patients that were invited to this. We provided the room space to do the blood tests and send on the forward referrals. From that project, about half of the patients attended, and we diagnosed 9 new prostate cancers at an early stage. Yeah, and we're very proud of that. In fact, we do realize from this project that there's half of those people who didn't turn up. Technically, there's 9 more undiagnosed in the
Mm.
community because they didn't engage with the project.
Oh, further, yeah. Yeah.
But we're planning on continue on with this so that we can reach out to them as well.
Mhm.
There was a dementia project that we ran, and our team managed to diagnose 27 new cases of dementia in housebound and frail patients that had been undiagnosed. We recently did a diabetes event in collaboration with Denbigh High School, where we had, I think it was roughly 61 patients attended. 580 interventions were done on site in Denbigh. So within the space of 2.5 hours, we had completed 580 interventions. And then we did some of the other stuff in the back office work. And overall, there were 715 interventions, including medication reviews and onward referrals to social prescription.
And that is amazing amount of work. And these have all been done recently, last year, this year, or more recent?
Yes, yeah. The diabetes event was literally just gone October the 31st that we've done, and the dementia screening is still ongoing. We're still waiting for some results from the hospital for 3 patients. Prostate cancer is in the second wave. We're planning on setting up the second wave now.
Okay. That was going to be my next question, really. How often are these likely to take place? Are they every once a year, perhaps? Or every 6 months? What?
Right, so primary care networks are doing things in new ways, and the idea is that we create new, innovative ways of working, not necessarily doing the same thing over and over again, but actually looking at innovative ways of doing something new. Diabetes reviews are done in general practice already, and they have been done so for many years. But this was just a new way of doing something to see how we could reach out to the community who don't respond, or just deliver the services in a different way. Dementia screening, again, is something that is being done by general practice, but with the way that we are working in our PCNs, it's just delivered in a different way. Hopefully, I think this year we're focusing on diabetes as smaller events, group clinics. We are setting up very soon. Menopause, we are going to be concentrating on, and some research as well.
Okay, brilliant. Listeners, if you have just tuned in, you're listening to Send in the Community with me, Hafiz Muhammad Umar, here on Inspire 105.1 FM. And in today's show, we are talking about the excellent work of the PCNs, the primary care networks in and around Luton, with a focus on Phoenix. And I'm delighted to be joined by Sister Farkhanda Mehmood, who is the manager at Phoenix, and she is telling me in depth about the amazing work they've been doing over the last year or so in and around a whole host of areas, but particularly the screeners they did around dementia, prostate cancer, and diabetes. And we will continue with that, if we may, moving on towards supporting the GP practices with staff to help them with capacity for minor illnesses. What kind of minor illnesses are you talking about there?
It could be anything like coughs, colds, infections in the eye, the small things that patients will call the GP surgery to get seen to.
Mhm.
I don't have an extensive list in front of me, but there is an extensive list of all of the minor illness that they can see.
Okay. And do you deliver any regular workshops for patients at all?
Yes, we have done some workshops in health and well-being with hypertension, anxiety, depression, and diabetes. And we plan on doing some more. Our social prescribers are very much linked to the community and arrange talks with different different members of the voluntary sector to discuss things with our patients who come in for our coffee mornings on Fridays.
Um, and you mentioned you've got a whole host of dedicated staff there. What sort of training do you provide them with in order to be able to meet the specific needs of this community in Luton?
So all of the staff have been on their mandatory training that is required for these additional reimbursement roles. The government has set out very clearly what they need to have in place before they can do what they do. Like, for example, the paramedics. There didn't used to be a paramedic role in PCNs. It was very much community and hospital. But when the paramedics have been recruited, so to speak, into primary care, they're seeing things in a different way. They go on a course called First Contact Practitioner course. This takes over a year. They need to where they are taught how to have consultations with patients, how to review them in a GP setting, really. And similarly for the other roles, the health and well-being roles, the physio roles, they all have to be retrained, so to speak, on how to deliver their services within primary care. But more than that, I think we also support the health and well-being of our staff, if that's what you were referring to, in terms of, generally speaking, primary care has always been firefighting. We recognise that staff resilience and retention has been an area of weakness, so to speak, in primary care. And to build that resilience, we have focused our attention on the health and well-being of staff to alleviate some of that burden, to create a supervision space so that we are providing them with a workspace that is safe and comfortable for them to be giving their maximum output to patients as well.
Brilliant. And have you had any feedback on that, how staff feel about this early training and health and well-being service you're offering to them?
Yes, we did a survey, I think it's been over a year now with the ICB, where they collated information on our staff. They've probably done it for all of the PCNs as well, but our PCN staff are very much benefited from the services that we provide. The health and wellbeing coaching, the supervision probably goes a little bit more deeper in terms of our PCN because our coaches are mental health qualified and we are able to deal with things that are possibly other PCNs aren't able to, like trauma and PTSD. But I don't want to go too much into that because that
mm,
doesn't really fall into the remit of what we do with our patients.
mm, 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 mm. I think it's just more a case of knowing the fact that the very people supporting patients are also able to access help and support themselves, and for patients to have the reassurance that they are human beings at the end of the day, and there is
Yeah, and a
a
lot
real case.
and a lot of that comes from the staff health and well-being. If
Mm,
our staff are not feeling happy and
mm,
satisfied and feeling passionate about their job, then
mm.
what kind of help can they give to patients if they're not feeling good about themselves? So that's very much why we look after the staff here at the PCN and make
Mm,
sure that their health
excellent.
and well-being is central.
Mm, mm. Um, in terms of long-term conditions, do you offer any kind of support to patients for self-help at all?
Yeah, so we have a website with some information on the website, but we mentioned of some of the reviews that we do. The diabetes, for example, is
Mm-hmm,
something that we are very much focused on because
hmm
we are one of those PCNs which has a considerable population of patients who are diabetic. So that's one of the reasons we've chosen that area to focus on. Diabetes is a long-term condition, and we don't just look at how to manage the diabetes in terms of clinical changes, but also in terms of empowering the patients so that they are able to recognize that they are in control of their disease, how they can manage it, how they can improve it, what they need to do to change, um, just to give them a little bit more empowerment.
Yeah, okay.
Yeah.
I'm
But
just going to, sorry, go ahead.
yeah, I was going to say that we do, in terms of our clinicians, frailty is another big area that our clinicians and service focuses on. So my clinical team have one of the services that they provide is looking after the housebound as well as the care home patients. So they will look after elderly and frail patients in their homes as well, go and do the reviews for them, see if there's any onward referrals, just providing that holistic care.
And what could patients expect from these kind of reality clinics then? You have somebody coming to your house, that's wonderful. What can they do for them?
So the team will go out and do a review for the patient just to see if there's anything that needs to be done clinically for them, have their annual blood tests, for example, their annual reviews, whether they're having any, one of these conditions that are long-term conditions like the asthma, like dementia reviews, asthma reviews, COPD if there's needed. If they need to have an ECG at home, then we can do that at home as well. Um, and then we can assess to see, does this person need any more support by having that holistic conversation with them? Is there something that we can support with onward referral to occupational health? Do they need to have some equipment in the house to help them to prevent them from having falls, for example? Um, Smoke alarms, we can refer on for that if there's some issue that becomes apparent in the visit, things like that, any safeguarding issues that need to be raised as well.
Mhm. And I think it's so important for people to be aware of the support available out there. That you clearly work, with the multi agencies there to ensure the correct level of support. And you mentioned the falls there. Now, I wasn't aware of the falls clinic until recently. The fact that there is a specific falls clinic, and any of our listeners out there who might think what that is, I don't know if you've done any work with the falls clinic at all in the recent past.
So
You guys.
yeah, the Falls Clinic team have been to one of our coffee mornings to talk about what they offer to the patients who come to our coffee mornings. So that's how we're trying to engage the teams with our patients, just really linking in. So Falls is it's a community team, so it's always been there. And obviously sometimes services and teams evolve and develop as time goes on to suit what's required in the community. But Normally, those would be the kind of referrals that a GP practice would do, but we could do them. And I suppose we probably see them more often in terms of ratio because of the type of patients that we see, the elderly, the frail, the housebound, the care home
Mm,
patients, for example.
mm, mm. And you mentioned the fact that how flexible they are in terms of meeting the community's needs. I'm known of them going out on a Sunday, for example, to do home visit simply because that's when he suited the working children of the patient they were going to see to make sure they were able to sit in and fully understand their offer. Sister Farhanda, thank you so much for your incredible work there. We are approaching a short break. Listeners, please do continue to tune in. Today on Sunday, the community show, I am joined by Sister Farkhanda Mehmood, who is the manager at Phoenix Primary Care Network here in Luton. And we are talking about the excellent work they are doing in and around Luton, in particular with those surgeries that they are affiliated with. So please join us straight after the short break. Thank you very much.
Stay informed, entertained, and engaged. Check out our new website, inspirefm.org.
Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah, amma ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the second half of Sending the Community Show with me, Hafiz Muhammad Umar. If you were with us during the first half of the show, you will know that in today's show, we are talking about the excellent work of the primary care networks in and around Luton, and we are focusing on the work of Phoenix today. And with me for the first half was Sister Farkhanda Mahmood, who's the manager at PCN Phoenix in Luton. Welcome back, Sister Farkhanda.
Thank you.
And I'm also delighted to be joined by Marie Brewis, who is the social prescriber. Welcome to you, Marie.
Bye.
And also Zabaida Fazal, who is the health and wellbeing coach at Phoenix PCN. Welcome to you as well.
Thank you.
So, thank you so much for coming in and joining us for the second half of the show, and also Sister Farhanda for continuing with us. Now, listeners, before we went to the break, you might recall we were talking about a whole host of things that PCN Phoenix offer in and around Luton, and one of those was around advice around treating minor illnesses. And if I'm just going to ask Sister Farhanda to elaborate a bit more on what might be considered a minor illness, then please.
Yep, so I've got a list in front of me now. Some of the stuff could be things like back pain or soft tissue injuries, eczema, acute rashes, heartburn, indigestion, fever, flu-like symptoms. Things like headaches or acne, sprains, skin conditions, sore throats, ear infections, hyperventilation, eye infections, BP monitoring, things like that, insect bites.
Okay, brilliant. Thank you so much for sharing that list with us. So all of those illnesses, if you come across them, please be assured that they are considered minor illnesses. And when the receptionist asks you about the nature of your illness, you tell them that they, I'm sure, will be able to signpost you in the right direction. Now, in terms of additional roles that we discussed of individuals who work alongside GPs in each of the surgeries, we went through the full list in the first half of the show. If you missed it, by all means, feel free to rewind this back. And we are going to elaborate a bit more on some of those roles now. And one being a social prescriber. And Marie, we know that's your official role. Do you want to tell us a bit about what social prescriber is and what people could expect from a social prescriber, please?
Social prescribing is a means of enabling health professionals to refer people to a range of non-clinical services. So we can help with anything non-medical that might be affecting somebody's physical or mental health, so poor housing, unemployment, loneliness, bereavements, anything like that that might be affecting their health. So we can help signpost and refer them to relevant agencies and support organisations. Sometimes this might be just like a one-off signposting somewhere, or it might be a more lengthy piece of work. For example, we've had a patient that hadn't come out of her flat for 2 years due to anxiety, and we've been building her confidence and getting her in touch with local organisations. So she now actually does, leave her flat and go to the shops or go to a GP appointment. So tasks can vary very much, really.
No, okay. So would it be fair to then say perhaps it's looking at the bigger picture that might be contributing towards somebody's illness rather than the illness in itself?
Yes, it's looking at the person themselves as a whole, the holistic approach
Mm.
of not just seeing the illness, seeing the person.
And I think that is so critical in terms of understanding what a person is going through. No individuals are, exactly the same, and so that's where you would look at the person's um, way of life, their current financial situation, perhaps if that is a worry that's adding to constant headaches, for example. I don't know. So they're the kind of things that you'd be able to talk people through. And what kind of services would you be signposting people towards then?
So one of the ones really for like finance and benefit advice would be, we have good links with the Citizens Advice Bureau. We have access to a total wellbeing employment advisor, so we can book in for sessions with those if they want advice around employment, if their health stopping them from finding a job. We work quite closely with the Alzheimer's societies, and for dementia patients, we can refer to those. Site concern, all sorts of organisations. We've been working hard to build links up, so we know the right place to refer people to.
Brilliant. And I mean, some of those services you mentioned, we've had them on the show in the past. Alzheimer's Society, for example, and dementia, we did a full show on them. And if listeners, you missed it, please go back on our website and listen for that. There are amazing people in our community who do lots of wonderful work to support every individual. Thank you so much for that, Anne-Marie. I'm going to move on to Zabaida Fazal now, who's the health and wellbeing coach. So, Zabaida, tell us a bit about yourself, then, please. What is a health and wellbeing coach, and what can people expect from somebody like you?
Yeah, so I'll start off with the official definition as given by NHS England. So a health and wellbeing coach supports people to increase their ability to self-manage, motivation levels and commitment to change their lifestyle. They are experts in behavior change and focus on improving health-related outcomes while working with people to set personalized goals and change their behaviors. They work with people with physical and/or mental health conditions and those at risk of developing them. So health and wellbeing coaches can be a very effective intervention for people who are experiencing a range of long-term conditions, including respiratory, cardiovascular, including type 2 diabetes and hypertension, as well as stress level and low moods. And they can also support people with weight management, diet, increasing activity levels. So that is the official NHS definition of what health and wellbeing coaches do. But like I explained to my patients, sometimes people think like, what is a health and wellbeing coach and what's the point? I want to see a professional, I want to see a clinician. But we do take a very holistic look at the individual. So if a patient was referred to me, 80% of the patients referred to me are from the GPs themselves. Patients would go into a GP, they may have a number of physical health conditions. And the GP, after doing various tests and assessments, there's medically there may not be something specifically wrong with them clinically, but they may continue to have those signs and symptoms that they continue to have. And I explain to my patients and I say to them, unfortunately, GPs are very restricted in terms of what they can do and how long they can see a patient for. So more often than not, you would have a 10-minute slot with a GP. And that would usually, most GPs would say, talk about one or two conditions. Life doesn't come with just one or two things that you can have at a time. Sometimes life can throw several challenges to you in one go, and which can't fit into a 2-minute slot, a 10-minute slot. Our sessions with our health and wellbeing coaches, there's a team of us here at Phoenix Sunrises. Our sessions on average last from 60 to 90 minutes. And they don't look at one challenge at a time. They look at the individual holistically and to identify what else may be going on in the individual's life. It is very much a personalized approach. So by that, what I mean is it's very much about what's individual to that patient that has come in to see us. So just to sort of give you a bit of an example, one of the most important things, like during our first session, it is more about building that rapport and building that trust with that individual. Because once you're able to do that, you're able to explore in more detail what the real issues may be. More often than not, a GP may refer a patient in for low moods or depression, etc. But as we explore those issues, a lot more may come out that the patient may not even have recognized or had an insight themselves. And most of this is about raising that self-awareness, raising that insight. So then patients are really better able to manage, the stresses and the challenges that come in their life. Yeah, so that's sort of really sums up the sort of things we do. We do have different patients that come in different problems. Sort of to give you an example of some of the things that the patients have come in and how we as a PCN work very collaboratively in order to address, and meet this patient's need. I've had one particular patient that came in from the GP for low moods. And as we were talking, what became very evident quite early on and during our session was that this particular patient, a mother, was really struggling because her child had autistic needs. They hadn't been given an official diagnosis, but the assessments were going through. And this mother was really, really struggling, which is then affecting her low moods, her ability to manage her family, her ability to even manage herself and to be able to function on a daily level, because she just didn't have the headspace. She was literally, as Farkhanda mentioned earlier, was constantly firefighting in terms of what was going on within her household. And that is one of the things that comes up quite a lot during my sessions, is how a lot of individuals are struggling. And struggling more so not because of what's going on for them, but the larger community as well. So this particular mother, as I was speaking to her about, her son's needs and what was going on and trying to raise her awareness of it, it became very evident that there were influences outside of the family home, which was affecting her ability to parent that child and meet the child's need, which was affecting her self-confidence and her self-esteem as well. And it's very sad when that awareness is not there within the community in order to, offer that help and support. And unfortunately, sometimes within our community, instead of having that support and have that support network, there seems to be some myths around certain illnesses or certain conditions which the community is not fully aware of, which actually hinder an individual's ability to manage a family or manage certain conditions. So to give you an example, and these are the mother's words when she said to me, she has been told by family and friends that she is being punished. She must have committed sins. And this is Allah punishing her for giving her a child who had autism. We had another patient who, because of not being able to meet the child's needs, because she herself was so unaware of what's going on for the child and she was really struggling. And instead of having that support within the family unit, there was animosity and those challenges were really brewing, causing a real friction even between the husband and wife. So we had one particular patient who said her husband was saying to her, you have been the biggest curse of my life. Marrying you, I've now been given this child who is just ruining my life. You have been a big curse to me. I don't know why I married you. So these sort of views only go on to hinder someone's ability to actually manage that. So I was hearing this quite often within my sessions, and then I would work holistically within the team. And this was something I was quite passionate about. And I spoke to our social prescribers and I said, you know what, there seems to be a consistent pattern of how these individuals are really struggling. What can we do to meet the needs of the community as well? So as a result of that brainstorming, we now have a autism support group that we have within the Phoenix PCN. This is run every Tuesday, is that right, Maria?
Every other Tuesday.
Yeah, so it's fortnightly, every other Tuesday from
10 o'clock. So we've got a little bit of a break at the moment. So the next one will be in a couple of weeks. This group, the first one, we asked the parents what sort of support they wanted, as it's their group, and it's not for to tell them what support they need. It's their group. So they gave us ideas and they wanted some advice on certain things like behaviour and eating and things like that. So we've arranged for organisations like Autism Bedfordshire to come in. Sarah from the local SEND offer has come in to speak to them as well. And already there's friendships forming in that group, and they are sort of supporting each other as well. So it's going really well.
Brilliant. And I just want to come in there, both of you, thank you so much for sharing You do so passionately. And you're right, both of you, in terms of the myths that have to be challenged. This nonsense about, oh, somebody being born with a special need or a condition, perhaps is some kind of a curse, is total nonsense. And there is a lot of work going on in the community to ensure parents and young people with the diagnosed condition are fully supported. We started this show last year, straight after Ramadan, and we started with Autism Awareness and Acceptance Month in April 2024. And there I was able to invite a very special guest from Harrow, who set up a project called Autism Mosque. And the theory behind there was that there should be safe space for people with autism to be able to practice their faith. And it's a lady called Sister Sarah Mangera who has gone around the country to inspire mosques to take part in that. So something as simple as that, if people want to be getting involved, they could easily search for Autism Mosque, and there are lots of useful tips on how to support people with autism when it comes to faith. And locally, you said that there are these groups that meet every Tuesday. Is that a particular surgery or in a community centre? Where do they meet?
Yeah, so these support groups, they're fortnightly, and if you visit the Phoenix website, we always have the dates on there, and if we have some special speakers come in or other organisations come in, that they will be detailed on there as well. So it's usually fortnightly, unless we have some other big event which clashes with our autism support group. But yes, fortnightly on a Tuesday from 10:30, was it? Yeah,
10 to 11:30.
10 to 11:30. And it's an opportunity for parents to be able to do that. So those of you that are patients who would fall in within Phoenix, our website is www.phoenix, which is PHOENIX, PCN Luton.co.uk. So we also, there is an Instagram page, we have Facebook. Marie's our social guru now, so she's getting us on different platforms, social media, to be able to have that better engagement and to raise that real awareness, because some of our patients still don't know who Phoenix are and what we do. Yeah.
So just to repeat that, listeners, if you are a patient of any of those 5 surgeries that fall under, is a 5, I'll double check, under Phoenix, that's Birmingham Park Medical Centre, Kingsway Health Centre, Neville Road Surgery, Malsey Road Medical Centre, Conway Medical Centre, or Pastures Way Surgery in Luton, then you are under the Phoenix PCN, and the website is www.phoenixpcnluton.co.uk. Is that right, ladies? Or if you just go into any search engine and type in Phoenix PCN Luton, that will bring up the website and also the social media pages. That's where I was referring to, like the Facebook or Instagram pages, and they are currently being monitored and regularly updated with the more events that are being planned for the near future. One being the fortnight meeting for parents or carers of people with autism. So in terms of the other roles within the PCN here, the pharmacy team, I'd imagine they would be expected to do what a typical pharmacy does. Is that right? Or do they differ to your high street pharmacies?
They do differ. There'll probably be some overlap in terms of what they can do compared to what pharmacists can do in community pharmacy. The pharmacists at the PCN have access to the patient's medical record as it is with the GP surgery. So they're able to look at, discharge summaries from the hospital, to update the medication on the patient's notes, amend them, change them where it's need to be changed, synchronize medication. They do structured medication reviews much more holistically than a community pharmacist could do, because they are able to see the whole patient in terms of other problems that they might have. Just responding to queries that patients might have that are medicine related as well. As I said, we at Phoenix are focused, one of our priorities is diabetes. So we have a pharmacist who is a diabetes lead, and a lot of the complex patients will come from the GPs, actually tasked from the GPs to the PCN. So she's able to titrate medication for people who are complex. Yeah, so that's just some of the stuff that our pharmacy team do. We work very holistically with the rest of the team as well. So the pharmacy team will work with our clinical team in the care homes as well to manage those patients who aren't able to, or the housebound patients as well, who aren't able to get to their GP surgery.
So it sounds like it's a lot more personalized kind of experience than it might be from your local high street pharmacy.
Definitely, and that's the additional roles are very much focused on personalised care, whether that's the minor illness clinicians or whether it's the social prescribers or the health and wellbeing coaches or care coordinators. They're very much focused on personalised care, that holistic care that you could get because of the benefit of time that we have, and because of the different ways of working. We work differently from GP surgeries.
Mm, mm. And moving on to care coordinators, then, what can one expect from a care coordinator?
Yeah, so care coordinators help to coordinate and navigate care across all of the services. They support the team here in terms of booking appointments, arranging services. But some of my care coordinators are also clinical care coordinators. So patients may have seen them in the practices. They help the GP practices with access. So that means providing them with more appointments. And through that resource, they can do things like phlebotomy clinics, so they can do the bloods for some of the surgeries, diabetes clinics, so they do diabetes reviews with all of the care processes, asthma reviews. They are trained in ECGs, so they are able to do ECGs as well. We have a service available centrally here at the base that we're based here at Birmingham Park Medical Centre, and we run some pheno clinics to help diagnose asthma. Yeah, and other than that, they do some of the back office work that is required by the practices in terms of helping them with things like discharge summaries, coding them onto the system. We're also increasing uptake in cancer screening, whether that's bowel, breast, or cervical screening. But we also, any of the projects that, like I've mentioned, they're very vital roles to help achieve the targets in any of the projects that we have.
And they also support practices with learning disability reviews as well. Right?
Yes, that's right. They can do numerous reviews. Yeah, quite long-term condition reviews. They do help the practices with as well.
Right. Okay, brilliant. Social prescribers we already mentioned. The only thing I wanted to ask Marie was when it comes to mobility issues, is that something that you're able to advise people on or signpost people, Marie?
So we work quite closely with our frailty team when they do the housebound visits. So quite often they'll come away with that saying they need like an occupational therapist referral or they need a care needs referral. So anything like that, yeah, we can help signpost to relevant referrals.
Brilliant. And then health and well-being, as Zabaida has mentioned in fair detail the excellent work they do. Just wanted to ask about the long-term mental health. Zabaida, do you do anything for that at all?
So in terms of health and wellbeing coaching, so we are health and wellbeing coaches. We are not mental health specialists. So somebody has a very specific mental health need, then they would be referred on to the mental health link worker, or referred back to the P to make those referrals back even to perhaps the community mental health team. But that's not to say that we don't work with individuals that have poor mental health or with diagnosed conditions. I work with a number of patients that do, but focus is looking at holistically at how they function outside, because their mental health is not the be all and end all. Their mental health shouldn't define that person. They could still be, a parent, a friend, a teacher, their life carries on. It's not mental health in itself isn't the whole person. It's just a part of the person. It's just reminding that individual that despite their mental health struggles, they can continue to lead a meaningful life. And that is the other thing I wanted to mention, Umar, because unfortunately within our community, even mentioning the word mental health seems to be a massive taboo. Many patients have coming to, into my service and asking about, oh, what am I here for? And I said, well, do you know why you're here? And they would just say, oh, I'm not sure. The doctor says something about, you may be able to help me. And I said, well, you referred for low moods, etc. And you have some people that are very, very defensive. They say, no, I haven't got any mental health problems. No, I'm okay, I'm fine. But we all have mental health. We can be on the spectrum. Exactly like I say to my patients, one day I could wake up and be in a really good place and my mental health may look really good and I may be very resilient. There may be other days where there may be several challenges going on in my life and actually my mental health could be seen as, on the other spectrum. And it's how do we cope with that and continue to lead me, a middle life, despite these challenges which come up in our lives. And also just to make patients aware, the health wellbeing coaches, we don't just work with females, we work with men too. And although within our community, there may be some resistance about the work that we do or men wanting to open up and speak up, I'm sure those patients that us health and wellbeing coaching, they will say how beneficial the sessions have been for them. I've had a number of male patients that I've seen and they said, I would have, if somebody had said to me, you're going to see a health and wellbeing coach, I would have said no, but the GP said, go, we need to speak to them. And actually, I'm glad I came because so much has come out of it. I've been able to tell you things that I wouldn't normally discuss. And that's what it is. It's about giving individuals that opportunity where, the right environment is created and it's a safe space for those individuals to come and talk about some of the challenges they have. And it's about empowering those individuals then to actually move beyond the fears that they have and the challenges and the barriers that are facing them in their lives, because we all will at some point have challenges and barriers. It's how we overcome those. And that's the approach that wellbeing coaches take. It's about empowering the individuals to go on and explore those new possibilities, have goals, have ambitions, have dreams, and know that you can achieve them. And it's just with the support of a health and wellbeing coach, we will facilitate that process.
Absolutely. And thank you so much, Zabaida. We are coming to the end of the show now. My thanks to Zabaida Fazal, Health and Wellbeing Coach at Luton PCN Phoenix, and Marie Brewis, Social Prescriber, and Farkhanda Mehmood, the Manager at PCN Luton. Thank you so much for your time, and it is highly appreciated. And we hope that your hard work will continue to make positive differences to our community. And this is it for today. And we hope that our listeners will tune in again next time and know that we will be in touch with Phoenix, PCN Luton again sometime soon. Thank you, ladies.
Thank you.
Jazakallah. Thank you so much.